Let's have a quick look at myocardial infarction, aka heart attack. So, a myocardial infarction is a complete blockage in one or more arteries of the heart, and it is a medical emergency. So, what happens is our coronary arteries become narrow due to plaque buildup. This results in a condition called angina, which causes chest pain due to a result of decreased blood flow to the heart. Eventually, this plaque ruptures and forms an occlusion known as a thrombi, blocking the artery, causing a myocardial infarction. So, signs and symptoms: sudden, crushing, radiating chest pain, and the pain can radiate to the arm, jaw, chin, shortness of breath, nausea and vomiting, sweating, and pale skin. Really important to note, in women, signs and symptoms can be different, and they often present with shortness of breath, abdominal pain, normally epigastric, and shoulder blade pain. So how do we diagnose these patients? So we perform an ECG, and a myocardial infarction can be split into two. So we've got a STEMI, which is ST elevation myocardial infarction, and an NSTEMI, which is a non-ST elevation myocardial infarction. We also take their bloods for a troponin, and troponin is a protein which is released into the blood during a heart attack, or any damage to the heart, to be fair. So how do we manage these patients? Immediately, we use the memory trick NOMA, so nitroglycerin to open up the vessels to improve blood flow, oxygen if their saturations are low but it's not always necessary, morphine for analgesia, and aspirin to prevent the platelets sticking together. Next up, we may send them to the cath lab for a PCI. They may need a coronary artery bypass graft, and they may need thrombolytics. And then we give them IV heparin or fondaparinux or dalteparin to prevent any blood clots. And then we also give them medications such as beta blockers and calcium channel blockers to arrest the heart. Hope that helps.